All right, I want to talk to you a little bit today about a patient who contacted me about a year ago. And he was a patient who had a prior procedure from another physician. And around 1,500 grafts he had. The results were not good. He had waited 18 months hoping for some sort of miracle to happen, but unfortunately it just wasn't a good result. I know the doctor, and he's a very nice guy. He's one of the nicest guys. He's very thorough in his workups, but let's face it, nice doesn't make you a great hair transplant doctor, and it certainly doesn't make you great in FUE. It takes a long time to become very good in FUE, and it behooves people that decide to perform FUE to get some training. A training from a physician who has a great deal of experience in FUE. And I'm not talking about coming over and watching one half a day of surgery or 2 or 3 hours of surgery and leaving and thinking you have it, because you don't. Every case is different. How you approach every case is different. What's going to work well in one patient is not necessarily going to work well in another patient. And so you have to know what to do. And quite literally, it takes years of experience working with a multitude of different types of skin to understand what to do, when to do it, and how to do it to become an expert in FUE. The United States, in general, did not accept FUE as a method of a treatment until roughly about 2013, 2012, 2014. And even today, some physicians do one case a month, and yet they offer FUE, when in fact, if they don't get some training prior to offering FUE, it's just not a good idea to offer FUE. Stick to your strips. Well, in order to remove his grafts, noting that he had some very large groups and hair bundles, I decided to use a variety of different punches to get his hair out. And so I started with punches ranging between 0.8 millimeters and 0.95 millimeters. And we averaged 3.24 hairs per graft. Follicle transection rate overall was under 5%. And we used a variety of different punches, the smaller punches for the 2 hair grafts and the larger punches for 3 or more hair grafts. And he had a very small percentage of natural 2 hair grafts, which was great. A high percentage of 3 and 4 hair grafts, which was great for him because we knew we could create a great result. And no 1 hair grafts. And that's another thing you see quite often with most FUE surgeons is they produce about 20% of their grafts are 1 hair grafts. 1 hair grafts don't exist in an average donor area. So if your surgeon is creating a lot of 1 hair grafts for you, for any place other than your hairline, it either means that he's not a very good FUE doctor, he really doesn't know what he's doing, or that he's getting a lot of follicle transection, or that you're just not a good candidate for a hair transplant. Because people with a high percentage of 1 hair grafts typically are not great candidates for hair transplant surgery. Now, I mapped out his surface area of loss. It was 79 square centimeters, and as you know, the entire donor area is 203 square centimeters. So this meant that we knew we had enough hair to get the job done, and we performed 2,700 grafts for him, and this is his result now at approximately 7.5 months. And just listen to the patient. He tells a good story.
Last couple of years, probably about the age of 23, I probably noticing some thinning and stuff like that. And as I got older, it progressed. And like you said, I went on the internet and tried vitamins, all kind of stuff, shampoos, you name it, I tried it. And it just seemed to work. So I went to a dermatologist down in New Orleans and started asking about get some information about the hair transplants and see what it was all about. And it was scary, but I was just trying to think of what I could do because my hair, I got on Propecia and it still wasn't working, and it kind of gave me a couple of side effects I didn't like. I actually went to a doctor in Florida and had a transplant, and didn't work out very well at all. Every day after I had the transplant done, I was in the mirror. And the doctors always tell you, just patience, you know, because you won't see really any results from, and everybody kind of differs, but pretty much 3 to 4 months, you start seeing a little, you know, some hairs coming up and stuff like that. But the first procedure, even though it didn't go well at all, it was about around the 8th month mark, and I was constantly calling the doctor, and he kept saying, oh, just wait, you're just a slow taker. And obviously I didn't get a good result. So even after a year, I started kind of giving up hope. And even though sometimes it can take up to a year or maybe a little longer, but by a year you should have some. I didn't know where to go, you know, from there. I thought that was, you know, it. And I was like, well, it failed. I'm not going to get any help. Until, like I said, I started looking at YouTube and seeing Dr. Cole's videos, and didn't know him at all. Just seeing him explaining some videos and explaining some stuff that he did, and I started getting really interested and started watching more and more. Then I went to the site, and I wound up finding his number and calling him, and and I called him on I think a Saturday afternoon. He was actually at his house, which was, you know, I could have also, I didn't mean to, you know, bug him, but he talked to me, and every time I had a question or anything, Dr. Cole was right there. Never had any problems. If I text him, he'd text me back, and like I said, he didn't know me, but he was very interested in what happened, and he just seemed like he cared, you know. And I know there's a lot of doctors out there that just, you know, just want to make the quick buck, but he was, just as a friend, just to get to know him before anything else, he was really, really good to me, you know. And you know, from there, it took a couple months, and he never pushed. He made me feel comfortable, and he was just pretty much, he wanted to know more about what happened than anything.
You know, I examined him, and from his prior procedure of 1,500 grafts in the front, he had a very poor yield, with about 0 to 30 grafts growing every square centimeter. This wasn't a very good yield. And his density was only 30 to 60 hairs per centimeter squared.
He never tried to get me into his office like, hey, come see us, we'll get you a full head of hair. It wasn't nothing like that. And I thought that was going to come from him, but it didn't. And he was actually a genuine person, you know, and to find somebody who actually, well, obviously does great work, he's very genuine also. And not just him, his whole staff, specialist photographer, he's a very nice guy. And his son, everybody at the office was really good to me. But so that's what I did, and I wound up going with Dr. Cole. And as you can see, you know, when I went, I was very nervous, and because you start going back to, well, I had this done before, and it pretty much didn't work out. But after picking Dr. Cole and going with him and his staff, with everybody there in Atlanta, I'm super duper happy. One of the best decisions I ever made, because obviously this is what I wanted, and I thought I was gonna get the first time, and I didn't. But now after going to Dr. Cole and the work he did was awesome. I started seeing results at right about 4 months, and I remember texting him, and he even told me, he's like, man, you got about the 4.5 month mark, you're gonna start seeing like an explosion. And I'm thinking, okay, at this time I had a couple of hairs coming out, but you know, so I didn't really get too excited, because obviously, like I said, I've been through it before. But I'm gonna tell you, he was pretty much right on the money, because at 4.5 months, I remember just one morning getting out the shower, and I was drying my hair, and I combed it back, and it started getting darker, where obviously I needed the hair. And I starting to see like a hairline come up a little bit, and it just took off. Like it was like you said, it's like an explosion, like it was crazy. And today I'm at 7 months. Okay, now I know it's going to differ from you know, person to person, but the CRP and the stuff he used also with the transplant, I mean, let me tell you, it's crazy how it works so fast.
In order to get this type of result this quickly, we have to use cytokine-rich plasma, or CRP. Now this CRP is so powerful that it's going to cause significant swelling of the face. Typically by the second day post-op, your eyes may even be closed. Hey Jude.
I'm doing videos.
Okay, have a video. You look
I look like I got to fight.
But that's how much this stuff turns on cells. And what this stuff does is it really helps get the hairs growing much quicker, and that's how we're now able to get these fantastic results at 7, 8 months that used to take 12 months or longer.
So from 4.5 months to 7 months, it's like night and day. That's all I can say about that, because it was just crazy. Like, it was just getting thicker and thicker and thicker. And like I said, today, this morning, I'm at 7 months on a dot, and I still have hairs coming up. And obviously, you know, your head's, some more hairs it's gotta mature and stuff like that throughout time, whatever. But I mean, patience is a big thing, but I'm here to tell you guys, this doctor's the real deal, and the kind of work he does is really, really awesome. Obviously, like I said, it's not a hair piece or nothing like that. It's real hair, and you know, it's dry. It's just, I don't have nothing in it, nothing to hide anything. You know, I can sit there and this might look bad, but this is real hair. You know, and I just wanted to let y'all know and show y'all. That.
If you like him to stay with him,
I'm getting ready for a movie.
Okay, I'm gonna get the hairline a little bit. You can lift your head up now.
So what I want to do is I want to just take some of this gel by Christo, NYC Men. I don't know, it looks like gel today. But let's see if it works with the hair. Man, it smells good. It smells really good. Is it going back? Not really sure what it's doing. We over here by TBT. If you're ever in Louisiana, Slidell, Louisiana. Got some good food over here.
Went to the Bahamas and caught 8 pound bluefin tuna.
One thing is, if anybody's watching this, the reason I'm wearing a hat is because you don't really want to get the sun directly into your grafts up until 6 to 8 months, and I'm very OCD and peculiar about everything in particular, so I'm definitely following Dr. Cool's rules about that. Even though I don't really have to because I'm at 7, but I'm just making sure I do everything. I don't lose one graft. I don't want to burn one graft. My family, of course, they know I'm particular. They're not surprised, but they are surprised about what the before and after came out like. They're like, that's pretty crazy. Especially my mom. My mom's a little older. She's this all technology. She thought, she's like, oh, so you got some plugs, but it's everything's came a long way since then. And when I took my hat off and told her, showed her, she's like, wow. She actually was like going through my hair. And she's like, wow.
He had a lot of gray hair. He's got a lot of hair. I'm definitely happy, and like you said, in a year, I'm at the 7-month mark, and at a year, I'm gonna come back and take more pictures and do some more videos. Just kind of let everybody see from the beginning to just, I guess it would be like a mid, and then to a year. Definitely recommend Dr. Cole. I don't recommend anybody else. That's the truth. And the truth speaks for itself, you know, if you watch my videos. Oh, the food's pretty good. I mean, Louisiana food. Can't mess with that. What y'all think about the food?
It's delicious.
Yeah.
Good choice.